So, epilepsy is a common type of chronic seizure disorder in which neurons in the brain become hyperexcitable and trigger electrical signals when they are not needed. The unnecessary signals cause rapid and repetitive refiring of nerves in the brain, leading to seizures. Seizures are the body's total responses to those inappropriate brain signals. When the signals reach the skeletal muscles, a convulsion may occur, which is a sudden contraction of many muscle groups without the person's conscious control. A convulsion is the part of a seizure that is seen as the motor response to these brain signals. Other parts of the seizure activity include changes in or loss of consciousness, a variety of sensory changes in vision, hearing, touch, smell, and taste, and autonomic symptoms such as facial flushing, incontinence, nausea, and drooling. Symptoms of seizures vary with the area of the brain affected and the type of the seizure experienced. Seizures are classified as partial or generalized. Each classification has subtypes based on symptoms, how long an episode lasts, whether convulsions occur, how widespread the response is, and the degree of change in consciousness. Partial seizures, classified as simple, no loss of consciousness, isolated or discrete motor symptoms, twitching of one toe or foot, changes in one or more senses, one or more autonomic symptoms, such as drooling, facial flushing, usually lasts about 20 to 60 seconds. A complex partial seizure, consciousness altered or impaired, and person does not respond to environmental stimulation, may have a fixed gaze stare and be motionless, automatism, performance of repetitive motions such as head turning from side to side, foot pedaling motions, usually last about 45 to 90 seconds. A partial with secondary generalization begins as a partial seizure with the patient retaining consciousness and then progresses to loss of consciousness. A generalized seizure all features loss of consciousness. The absent petit mal. The consciousness loss is brief, 10 to 30 seconds, without loss of posture, minimal or no change in motor activity. A tonic-clonic grand mal, often preceded by an roar or cry, whole body convulsions starting with wide muscle rigidity, followed by powerful contractions, loss of posture, urinary incontinence, confusion after muscle responses are over, and usually lasts less than 90 seconds. An atonic, muscle tone loss in one or more muscle groups, and usually lasts about 10 to 60 seconds. A myoclonic is brief 1 to 2 seconds, contractions of one focal or more muscle groups, can involve the whole body. Status epilepticus is a single seizure lasting 50 to 30 continuous minutes or a series of recurring seizures between which the patient does not regain consciousness, may be convulsive, absent, myoclonic, or generalized convulsive. This is actually life-threatening. Febrile, tonic-clonic seizures induced by temperature elevation, usually children, lasting 15 to 30 seconds. A variety of problems can produce seizures. For example, high temperatures in infants and children, strokes, head trauma, brain injury, meningitis, and poisoning, especially from excessive alcohol intake or drugs, may induce seizures. Epilepsy is one cause of chronic and recurring seizures. Although other types of epilepsy management exist, most often drug therapy is used. An anti-epileptic drug, also known as AED, is a drug that reduces or prevents seizures. AEDs are divided into traditional and newer categories. Some drugs categorized as AEDs have additional uses for other problems and disorders. Anti-epileptic, also known as anticonvulsant, is a classification. The action is delaying sodium from crossing the neural membranes. This effect decreases the potential for too much electrical activity and calms the cell. The example of the drugs are phenytoin, Dilantin, carbazepine, known as Tegretol, phenobarbital, known as Schedule 4, valproic acid, known as Depakote, lamotrigine, known as Lamictal, levetiracetam, known as Keppra, topiramate, known as Topamax, locosamide, known as Vimpat, and gabapentin, known as Neurontin. Phenytoin is an AED that reduces or prevents seizures by binding to sodium channels on nerve membranes and making them less active, which prevents the spread of neuron excitability. This and similar anticonvulsants are among the oldest drugs used in the management of epilepsy and are available as tablets, capsules, liquid suspensions, and solutions for injection. A prodrug of phenytoin is fosphenytoin, Cebix, which is available only intravenously, and it is used on a short-term basis. It is converted to phenytoin in the body. Phenytoin anticonvulsants are approved only for treatment of seizure disorders. Carbazepine is an AED that limits the spread of neuron excitability by altering the sodium channels of nerve membranes to prevent or slow the refiring of neurons. Its structure is similar to that of the tricyclic antidepressants. This drug is often used to control epilepsy in children. It is also used as a mood stabilizer and to reduce skeletal muscle spasms. Ethosuximide is an AED that raises the seizure threshold by altering calcium channels on neuron membranes. The number of seizures is reduced because stronger excitability is needed to stimulate them. Although this drug can help reduce all types of seizures, it is most effective for absent seizures. Ethosuximide is used to reduce seizures during pregnancy because it is less likely to cause birth defects than phenytoin. Phosphophenytoin, or carbazepine. Phenobarbital is a drug from the barbiturate class that raises the seizure threshold by enhancing the action of the inhibitory neurotransmitter GABA, resulting in widespread CNS depression. It is the oldest drug used to control seizures, and it is also used as a sedating agent. Phenobarbital has the longest duration of action of the traditional AEDs. It is used for all types of seizures except absent seizures, and it is used on a short-term basis for insomnia and anxiety. This drug is available in tablet form, oral solutions, and solutions for injection. Primidone is a prodrug that is converted to phenobarbital in the body. It has the same actions and side effects, interactions, and precautions as phenobarbital. Valproic acid is an AED that raises the seizure threshold, that possibly increasing the activity of the inhibitory neurotransmitter GABA. Not all of its actions are known. It is often combined with divalproex sodium to increase its duration of action and to reduce the frequency of dosing. In addition to treatment of most seizure types, valproic acid is used to help manage manic types of bipolar disorders. The nursing implications for Lamictal: use the correct starter kit when drug therapy begins to avoid complications and interactions. Assess the patient daily for a rash, which can signal the beginning of life-threatening skin reactions. If a rash is detected, withhold the dose and notify the healthcare provider immediately. Teach patients to check themselves daily for rashes and to tell them to notify the healthcare provider immediately if a rash is found. Check with the healthcare provider to determine whether folic acid supplements are needed, because this drug interferes with the production of folic acid in the body, and some patients may become folic acid deficient. Carefully check the dosages prescribed for Black patients, because clearance rates are lower and lower dosages are often needed for these patients to prevent drug overdose. To prevent accidental or injury, instruct patients not to drive or operate dangerous equipment when their vision is blurry or doubled. The nursing implications for Vimpat: monitor patients for orthostatic hypotension and take steps to prevent falls, such as accompanying the patient during ambulation. Instruct patients to change positions slowly, especially when moving from a lying or sitting position to a standing position, because this drug can cause orthostatic hypotension and syncope. Remind patients that even if they like the mood produced by the drug, not to increase the dose or how often they take the drug in order to avoid psychological dependence. Instruct patients not to drive or operate dangerous equipment when their vision is blurry or doubled to prevent an accident or injury. Give IV infusions slowly over 30 to 60 minutes to avoid injection, site pain, and heart rhythm problems. Monitor the patient's blood pressure and heart rate and rhythm before giving the drug IV, every 15 minutes during the infusion, and after the infusion is complete, to identify severe hypotension or heart rhythm problems. The nursing implications for Topamax: monitor laboratory values, especially blood pH, electrolytes, and ammonia levels, because this drug can cause metabolic acidosis, elevated ammonia levels, and encephalopathy. Assess patients for symptoms of encephalopathy, such as the development of lethargy, vomiting, changes in mental status, and hypothermia, and report these immediately to the healthcare provider so that prompt encephalopathy treatment can begin. The risk of metabolic acidosis is greater if the patient is also taking metformin for diabetes control. Assess patients for symptoms of metabolic acidosis: a slow heart rate, hypotension, muscle weakness, and warm, flushed skin, and if present, report these symptoms to the healthcare provider immediately. Follow dose increasing schedules exactly to avoid adverse reactions. The nursing implications for Dilantin. Dosages for different forms of phenytoin are not interchangeable because the drug concentrations vary by type. Warn patients that gum hyperplasia is a side effect of this drug and that good oral hygiene is needed to prevent tooth loss from gum disease. Remind patients who take warfarin that closer monitoring is needed for the warfarin dose may need to be adjusted because phenytoin has mixed interactions with warfarin effect. Ask patients about all other drugs they take because phenytoin interacts with many other drugs. Check with a pharmacist and the patient's healthcare provider about the need for dosage adjustments with any drug. Avoid giving this drug by the IM route because it is a severe tissue irritant. Phenytoin causes birth defects and it is not used during pregnancy. Teach patients to measure their pulse rate daily and to report changes and irregularities to their healthcare provider because these drugs can cause bradycardia and other heart rhythm problems. The nursing implications for carbazepine. This drug causes birth defects, and it is not used during pregnancy. Teach the patients to measure their pulse rate daily and to report changes and irregularities to their healthcare provider because these drugs can cause tachycardia, AFib, and other heart rhythm problems. Instruct patients to walk slowly and carefully, especially on stairs, because this drug can cause ataxia and increase the risk of falls. Remind patients who take warfarin that closer monitoring is needed and the warfarin dose may need to be increased because carbazepine reduces the effect of warfarin. Ask patients about all their other drugs that they take because carbazepine interacts with many other drugs. Check with the pharmacist and the patient's healthcare provider about the need for dosage adjustments with any drug. Suggest that patients take the drug with meals or a substantial snack to decrease GI problems. The nursing implications for phenobarbital. Ask patients about all other drugs that they take because ethosuximide interacts with many other drugs as well. Ask the pharmacist and check with the patient's healthcare provider about the need for dosage adjustments with this drug. If the patient has GI side effects, suggest that he or she take the drug with meals or substantial snack to decrease these problems. This drug may be used during pregnancy because it has a lower risk of birth defects than do other traditional anti-epileptic drugs. The nursing implication for valproic acid. Remind patients who take warfarin that closer monitoring is needed and that the warfarin dose may need to be decreased because valproic acid increases blood levels of warfarin. Remind parents of young children who are taking this drug to check the child weekly for yellowing of the skin, of whites of the eyes, and darkening of the urine, or light-colored stools because severe liver toxicity can occur. If any of these changes are present, notify the healthcare provider. Give IV infusions slowly over 60 minutes to avoid injection site pain and severe dizziness. This drug causes birth defects and is not used during pregnancy. The traditional anti-epileptic drugs such as phenytoin, Dilantin, carbazepine, Tegretol, phenobarbital, Schedule 4, valproic acid, Depakote, lamotrigine, Lamictal, levetiracetam, Keppra, topiramate, Topamax, lacosamide, Vimpat, Schedule 4, gabapentin, Neurontin. The traditional AEDs include these drugs, although there are some newer AEDs listed as well. Some of the older AEDs are given along in conjunction with some of the newer AEDs. Although the older AEDs have more side effects and other issues than do some of the newer drugs, they are still used effectively today for most patients, often in the combination with the newer AEDs. The general nursing considerations before giving an anti-epileptic drug is obtain a complete list of drugs that the patient is taking, including over-the-counter, any herbal remedies or preparations, because the drugs could potentially interact with numerous other drugs. Always consult a drug reference book or pharmacist to determine possible drug-to-drug interactions between AEDs and any other drugs the patient has been prescribed. Check baseline vital signs, level of consciousness, gait, all of which can change as a result of AEDs being administered. Assess the adolescents for recent changes in height and weight, because these drugs affect the dosages needed to prevent seizures. Ask female patients of childbearing age if they are pregnant, planning to become pregnant, or are breastfeeding, because many AEDs increase the risk of birth defects and enter breast milk and affect the infant. Ask patients whether an aurora occurs before any seizure activity. Tell the patient to put on his or her call light if he or she feels that a seizure is about to occur. In the planning and the implementation of AEDs, place the patient's bed in the lowest position and raise the side rails to prevent injury. Remind the patient to call for help when getting out of bed, and make sure that the call light is within easy reach, because many AEDs cause dizziness. Make sure that oxygen and suction equipment are in the patient's room and in good working order in case a seizure does occur. Monitor the patient for seizure activity and be prepared to protect the patient from injury if one occurs. Monitor regularly scheduled blood drug measurements to determine whether levels are in the effective range or could cause adverse reactions. Many AEDs increase suicidal ideation. Report to the healthcare provider immediately any patient statements or actions that indicate he or she may be considering self-harm. AEDs work in the CNS and depress its activity to some degree. They should not be taken with alcohol or any other type of CNS depressants. Suddenly stopping AEDs therapy can result in seizures itself. When changing drugs or discontinuing drugs, taper doses slowly to reduce the risk for seizures. Considering drug-to-drug interactions, the list is actually very long and includes very common drugs such as aspirin, acetaminophen, oral contraceptives, proton pump inhibitors, and drugs for diabetes. Of particular note are the drugs used to manage psychiatric problems and warfarin. To prevent severe complications and adverse reactions, avoid other prescription drugs unless the benefit outweighs interaction risk. Instruct patients to avoid over-the-counter drugs and supplements unless prescribed by their healthcare provider. Always consult a drug reference or pharmacist to determine possible interactions between AEDs and any other drug a patient is prescribed. The general patient and family teaching points for anti-epileptic drugs. Make sure the patients understand the importance of keeping the follow-up appointments with a healthcare provider to monitor the drug effectiveness and the drug blood levels. Instruct patients to take the drug exactly as prescribed and not to suddenly stop taking the drug because seizures may occur. Teach the patients to take a missed dose as soon as it is remembered, but not to take a double dose. Patients should understand to immediately report any new or worsening or unusual symptoms to the healthcare provider. Remind patients to avoid adding any over-the-counter drugs or supplements without checking with their own healthcare provider to prevent possible drug-to-drug interactions. Make sure the patients understand to avoid alcoholic beverages or other drugs known to depress the CNS because of the severe CNS depression. For patients, alcohol triggers seizure activity. Remind patients to avoid driving, operating dangerous equipment, or doing anything that requires mental alertness until they know how the AEDs affect their level of consciousness and reflexes. Tell patients and families to notify the healthcare provider if signs of depression are seen, because many of these drugs increase depression and suicidal ideation. The most common side effect of phenytoin is gum hyperplasia, especially with long-term use. Other common side effects include abdominal discomfort. Unlike many other AEDs, phenytoin does not cause drowsiness. The most common side effects of carbazepines are constipation, nausea and vomiting, and ataxia, an unsteadiness when walking. Other side effects include itching, rash, muscle weakness, and an increased risk of sunburn. Ethosuximide has fewer side effects than other traditional AEDs. The most common side effects of this drug are heartburn, dyspepsia, nausea and vomiting, dizziness, drowsiness, and fatigue. The adverse effects of this drug are rare. Phenobarbital and primidone have many CNS side effects, especially drowsiness and ataxia. Additional side effects include blurred vision, dizziness, and mental status changes. These problems are most apparent when therapy first begins and become less severe over time. The most common side effects of valproic acid are drowsiness and muscle weakness, nausea, diarrhea, and menstrual irregularities. Additional side effects include anorexia, double vision, and blurred vision. Instead of drowsiness, some patients have insomnia. Phenytoin is a known tetragen that causes birth defects. It should not be avoided during pregnancy. Other adverse effects of phenytoin include the red blood cell problem of anemia, reduced white blood cell counts, increased risk of infection, and reduced platelet counts with increased risk of bleeding. Although they are not common, heart rhythm problems, especially bradycardia, which is a slow heart rate, can also occur. Rashes caused by phenytoin can progress to a widespread and serious problem known as Stevens-Johnson syndrome, which can result in skin sloughing and other complications that require immediate medical attention. Carbazepine, like phenytoin, affects the bone marrow, leading to anemia, reduced white blood cells with increased risk of infection, and reduced platelet counts with increased risk of bleeding. Heart rhythm problems may lead to tachycardia, a rapid heart rate, AFib, and severe hypertension. Phenobarbital and primidone can cause severe CNS depression, especially when given parenterally. It can cause respiratory depression and should not be given to patients who have chronic obstructive pulmonary disease or any other severe respiratory impairment. Phenobarbital has an increased risk of physical and physiological dependency, especially with long-term use, and it is classified as a Schedule IV controlled substance. The many other possible adverse effects include bone marrow depression, cognitive impairment, exfoliative dermatitis, liver impairment, bradycardia, and coma. In some cases of acute overdose, the patient may show exaggerated CNS depression, slow and shallow respirations, small pupil size, meiosis, tachycardia, areflexia, and absence of reflexes, shock, or coma. Death may occur as a result of cardiorespiratory failure. Consult a drug reference for a more complete list of adverse reactions associated with phenobarbital. Valproic acid has been known to cause amnesia and heart rhythm irregularities, especially tachycardia. Hearing loss and GI bleed are also possibilities. The evaluation or expected outcome is decreased frequency of or cessation of seizures or seizure activity. The neuroleptic malignant syndrome acronym, fevers. So the neuroleptic malignant syndrome is a syndrome that is created by medication. When seizure medication is given to a patient, or psychotropic medications, or any type of medications that is given to a patient that is going to cross over the blood-brain barrier or the CNS and change the CNS, it can potentiate symptoms that look like the neuroleptic malignant syndrome. And those symptoms are fevers, hyperthermia. So the temperature of the patient can go up and down. It looks like there's an infection. It looks like there's not an infection. So the clinical manifestations get kind of confusing looking. The patient begins to show some signs and symptoms of encephalopathy. So they are looking and talking like they are confused, like they don't make sense, like they have word salad. The vital signs become a bit unstable. They don't make sense. Before you know it, we're starting to draw labs. The labs look okay, but really what we should be considering is to drawing some cardiac enzymes, also identified as CPK. The patient might have some symptoms of physical diaphoresis. We might do an AccuCheck but find that the blood sugar is fine, but really these are cardiac symptoms that we're dealing with. Maybe there's some rigidity to the muscles, and that might start driving further assessment of looking at cardiac enzymes. The patient may advance further into symptoms which might be seizure activity. And if that's the case, this could potentiate into death if these symptoms are not recognized readily, quicker versus later. So an acronym for the symptoms for neuroleptic malignant syndrome is FEVERS, F-E-V-E-R-S, representing fevers, encephalopathy, vital signs that are unstable, elevated enzymes, rigidity of muscles, and seizures. Don't forget to refer to your standardized lab value sheets for your anticonvulsant, anti-seizure lab values for phenytoin, lamotrigine, your levetiracetam, carbazepine, and phenobarbital. Oh, and don't forget your gabapentin.